Hello, stroke warriors and TBI survivors everywhere. This is Ralph with Stroke Warrior Radio with another therapist interview session. And today our guest is Dr. Brittany Zeese. Is that correct?
Powers. It's
Oh,
from
flowers. Where'd I get the
Powers.
Zeese?
I don't know where that's from.
Wow, I got
That's
that on the
okay.
website somewhere. Oh well,
That's
Brittany
okay.
Flowers. Uh, you're called the Motion Mama. Is that you?
Yeah, I'm trying to brand myself as something to combine physical therapy and my favorite role of being a mom. So,
Oh, cool.
yeah.
Well, I do know you're a physical therapist, a doctor of physical therapy, but I
hmm
don't know what a CNDT is.
I'm wondering if you have me mixed up with somebody.
No, I don't think so.
Where is it saying that?
Am I looking at the wrong thing? No, it's all there.
Well, I would guess that's something I would be liking to acquire at some point. I believe that's probably the certified NDT therapist, the
Oh, okay.
neurodevelopmental technique. Yes, that's something in the future that I would like to attain, but I'm wondering.
Okay. Well, tell us a little bit about your background.
Sure. So, I've been a physical therapist for 5 years. I'm up in New England. So before PT school, I wasn't sure exactly which setting I wanted to be in. So you started working at a pediatric clinic, thinking maybe that's the route that I like because I love working with children. And then I got into PT school and I took my first neuro re-ed class, and I just fell in love, and I went on a clinical rotation to an inpatient rehab, and it completely changed my outlook. And I just knew from then that the neuro population, stroke individuals, individuals have had TBI, things like that. I felt such a huge impact working with them, and I knew that was going to be my lifelong career.
Could you share your path to physical therapy and what led you to specialize in a neuro rehab?
Yeah. So I always knew I wanted something physical. I always liked how the body moved. I thought it was always an interesting thing. And I, even just as a young kid, I could just see how much we take for granted, just being able to get out of bed, get up, go for a walk. And then again, working at that pediatric clinic that I worked at, we had a young boy who was in an accident, and he was getting surgery, and actually during the surgery they kind of messed up with his anesthesia, and it caused him to have a stroke. And so that was one of my first introductions to the stroke population, and just being part of his recovery just as a rehab aide, it was incredible, and seeing how far he could come, and watching him walk out with his mom at, I think he was at the time 9 or 10. He was using a little walker, but just seeing him get back to being a kid, being a person,
Yeah.
it was just amazing.
Wonderful.
Yeah.
Did you happen to have him for physical therapy after the hospital?
No, but his mom actually added me on Facebook back and then, and so she still keeps up with me sometimes. And he doesn't use a cane anymore or any kind of device anymore. He's just, you wouldn't even know what he went through. It's amazing.
Isn't that great? I mean, so many people were told this is good as it gets.
Oh,
It's 3 to 6 months. I just want to punch a doctor or therapist that says that to me.
I know. Yes, I get a lot of patients that say that. They're like, "Oh, so and so told me that this time in inpatient rehab is all I get." I'm like, "No, it's a big chunk for sure, but you can have you can see progress years down the line. Even if it's
Yeah.
something small, it's progress."
Yeah. I mean, mine was 7.5 years and I got off my cane and now I can run on a water treadmill and do all
Wow,
kinds of things. So yeah.
impressive. Proud of you.
Well, thanks. Um, you mentioned when we were talking before about your love of being a mother.
hmm
I'm curious. I'm always curious, especially how my schedule goes, how busy it is with everything. How do you
Yes.
um how do you balance that?
Yeah, good question. It's always a work in progress. And especially, kids change every day, so keeping up with her changing, she's just over 1 now. She's 15 months. So, I feel like I had maternity leave. I had my time to be like, okay, I'm a mom. This is amazing. And then I got back to work and I was like, all right, how do I, still feel like I'm the one raising her, but also still putting my 100% effort into my job. So it honestly, I don't know if it's because PT has always been something I've wanted to do and being a mom has always been something I wanted to do, but that both it came very naturally to me, I guess. Um, and of course I miss her when I'm at work and I would love to be home, but I think being in this profession and changing people's lives and seeing the difference in them, it makes it worth it.
Has being a mother influenced your approach to physical therapy?
Certainly, especially because for the most part, my patients happen to be a little older than me, usually anywhere from 50s, 60s, up to 80s and 90s. And they all talk about their kids, and the kids come in and they say, oh, thank you for taking care of mom, all that stuff. But now being a mom myself, I can, I think of it down the line of like, will my daughter be the one in with me? And just it's really changed my perspective, especially with the slightly younger patients when they're saying, oh, my teenagers are in sports and I want to get back to spending time with them and being able to practice with them. It's just I can feel that now more on an empathetic level versus just sympathetic. So
Oh, I love that.
yeah.
What yeah, again, it's kind of a weird question, but what strategies do you employ to balance your professional life with your uh, family life?
Personal life. So I'm very fortunate, I think, just in the setting that I'm in, and I think the fact that I've been at it for 5 years, I was able to develop a better um, schedule, meaning I don't work weekends anymore, which is huge. I was able to, just be a Monday through Friday, so I have the full weekend with her, which is great. Sorry, my cat's jumping up here. um, so, and I again, it's the setting that I'm in is wonderful. I have such a great team, and they're very understanding with flexibility. So if she has appointments that I have to go to or things like that, I can go to all that stuff. I don't feel like I'm missing out on those things. You know what I mean?
Yeah, yeah.
Yeah. So, and I'm very present with her. So as soon as I pick her up, I mean, it is just her and I until she falls asleep. It's every moment is just with her. So.
That's fantastic. You
And
sound like a fabulous mom.
oh, thank you. It is
Are
my
you,
favorite role.
yeah, exactly. Um, your experience as a inpatient, you started as an inpatient rehab, right?
Yep.
Now, and now you're at a clinic? What do
I'm
you,
I'm
what?
in a I'm in an inpatient, part of it's inpatient rehab, part of it's a SNF actually.
Oh,
So
okay.
still similar. Some of my patients will transfer right over to the other side anyway. So
Okay.
yep.
Well, nice.
Yeah.
What patient demographics do you usually deal with?
So I do get a lot of patients in the neuro population. I get my stroke patients, which I always obviously, of course, love working with them. I do get a lot of, well, I shouldn't say a lot, some orthopedic, so like motor vehicle
Okay.
accidents, things like that. A lot of the sniff side, especially, is a more general deconditioning from whatever it might be, a CHF exacerbation or COPD exacerbations, or they fell at home and injured something, things like that.
Okay.
Yeah.
What specific do you deal with TBI also at all?
Yes, yeah, he actually just went to he left probably a week or two ago. He was a young 51-year-old man. He was awesome. But yes, I do have a few TBI patients as well. They're awesome.
What's the unique challenges that you're faced with when developing treatment plans for these patients?
So it's interesting that everybody is so individualized. You cannot walk into a room and be like, all right, this is what I'm gonna do, this is what I'm gonna say, this is how they're gonna react. You don't know anything. So I think a challenge in a good way is just going in open-minded, being flexible, and just sometimes expecting the unexpected. You never know what they're gonna do or think. And obviously going through what they've gone through, they're gonna be fatigued. They might have some cognitive impairments or aphasia or poor insight, things like that. So there's a lot of factors that go into their recovery. So there are a lot of challenges there, but it's awesome.
it sounds very much like you don't have a checklist. You sit down with your patients, don't you?
Oh, of course. Oh, yes.
Okay. Yeah, because that's always been a frustrating thing for most of the people I know in the stroke community or TBI, is
Mm-hmm.
that, they just, I had therapists for 2 years put me on a bike and walked away.
Oh,
Pretty, it's like, come on, we got
yeah.
to
That.
develop things. But then again, I had a therapist that asked me what I did before, and I was a contractor. So
Mm-hmm.
she asked me what I would like to be able to do again. I said, climb a ladder. She
Yeah.
actually
Yeah.
brought a ladder to physical therapy.
That's incredible. That's a good therapist.
Yeah, exactly, exactly.
Mm-hmm.
Then she retired.
Yeah, oh, of course. That's a huge
Uh,
question I ask though, because I always tell my patients, I didn't get the privilege of knowing you before this. So bring me through a day in the life of so and so because I want to know what you were doing before.
Wonderful. Do
Yeah.
you, do you have certain interventions that are most beneficial for stroke and TBI patients?
So I'll do a lot of task specific things. So obviously gait training, transfer training, things like that. I actually posted about this fairly recently. I like obviously, light gait or any of those kind of big equipment because if I can focus on the specifics of them versus holding them up to help them walk, if I can focus on how their leg is moving and helping with placement, I like to do that. So, but if I don't have access to a machine like that, I try to get creative. So I posted recently about using a long resistance band and I'll tie it all around their foot, their knee, and their hip. And it's such a cool way for them to actually be able to accelerate that leg forward and clear that foot and bend that knee. And they feel like they're doing more of the work. And I think that's a big part of it for me too, is like I'm there to help them, but I want them to feel like they're doing it. You know what I mean?
Yeah, yeah, I do.
Yeah.
And it's always curious to me because in the beginning, most of us have cognitive issues. Of course, we've had a brain
Right.
injury,
Mhm.
So I mean, what should a new survivor look for in a physical therapist? In other words, is it protocol? Is it sitting down and saying, hey, you know, there's got to be something better than what's going on?
Right. Right. I think it's those things. I think what we had said before, like if somebody walks in with a checklist or a clipboard and says and just is just rattling off questions. I mean, there's obviously questions that I'll ask multiple people, but I like to look at my person and I'm looking at them as a whole person and I want to ask about their life and their goals and where they were before, where they want to be because it's that whole person approach. If somebody's coming in and saying, "Okay, or do you have pain? What hurts?" You know what I mean? If they're asking the very basic
Yeah.
questions, it's just
Do, go
yeah.
ahead.
No, I was just gonna say that it's just they're not always looking at the whole picture, and I think finding somebody that really seems like they care about you is a huge thing, and somebody that's willing to be creative and flexible. And like I said, like you said, there's cognitive issues sometimes initially, so somebody that's patient and again just trying to find what works best for their specific person.
Do you find it's better to have the caregiver as participate in the therapy sessions?
I do for the most part. Sometimes I like a couple
Yes,
sessions individually because that
right.
can, play a difference too. And again, I really want to see the person as themselves. But sometimes when their caregiver and their loved one and familiar face is there, they can be more themselves in that case. But I try to feel it out. So I do some sessions with, some sessions without, and see what benefits my patient the most. But I will always do caregiver education and things like that because it's I'm only with them for a couple hours a day. Those other 20 something hours, I want them to be able to, carry out what we've worked on. So
That's awesome. I,
yeah.
I, I took me a long time to figure this out, but um, I became the captain of my own team. Do you find that's a better relationship with you if they or that person?
I believe so personally. A lot of my patients always say they're like, "You're the boss." I'm like, "No, I'm really not. I'm here to help guide and I'm here to help, push the train along, but you're driving. You're the one going through this, not me. I'm just here to help you get where you want to go." Um, you know, um, so I make that same joke with my patients. I'm like, "I'm not the boss. I might be
Yeah,
getting paid to be here, but I'm not driving."
yeah. One of the funny things I always um, didn't realize was I was allowed to fire my physical therapist,
Yeah.
my
Yep, you are.
occupational therapist, whoever. I mean,
Mhm.
because there's so much laziness, I want to say, and some
Unfortunately.
therapists, they're just there for the job, not for the work. And it
Mhm.
doesn't sound like you're that at all. So,
No, I well, thank you. I appreciate that. I I know obviously want to be humble. I really am not there for the paycheck. It's just I don't know. That takes the heart and soul out of it. That's not why I'm there. And I do see that with therapists or even especially in my setting, nurses or, other professions, they're just kind of there to get through their day. And it's like, I don't think you realize the impact you're making on these people's lives every moment you're with them. So,
yeah. How do you incorporate technology like virtual reality or neurofeedback or any of that in your rehabilitation programs? I
yeah.
mean,
So
it's becoming more prevalent, right?
it is. It really is, especially with AI nowadays. I don't know where this is going to go.
Yeah.
But I do use some biofeedback, some like auditory feedback, things like that. Or we do have like a TV with a Wii set up, so I'll do some, virtual. Well, not a virtual reality, but just some kind of gaming, just to have fun with it. We have Wii Sports, so a lot of my golfers or my whatever. I think there's tennis on there, all that kind of stuff. We'll just play that for fun, especially in the winter when we can't do much outside.
Yeah.
Um, and actually, one thing I was interested in, I haven't looked into it yet, or to actually, um, you know, go through with it. But I saw an interesting study recently about Apple Watches being used for individuals with Parkinson's. There was a new study about that. There's I don't know if it's an app or however the watch detects it. It can show like a slowing of their movement. It can kind of tell them when they're in more of that slowed phase versus a higher state. So it's very interesting.
It sounds like it, very much
Yeah.
so.
Yeah.
Um, what mode, I, I'm just, you're so positive. I mean,
Oh,
I'm jumping all over because
that's
it's just,
okay.
and really refreshing to talk to somebody with um, your advocacies, I should say. Which
Well,
brings me
thank you.
to, yeah, which brings me to what kind of advocacies do you get involved in? Community advocacies, other organizations?
Yeah, so I'm part of the stroke group at work. So it's like a core stroke group, we call it. So we'll discuss, what's new in the field, things like that, how we create like caregiver packets, things like that that we can provide for our patients' families, just to kind of give everybody the most information about what a stroke is, what recovery looks like, what it's going to look like at home, what to look for so it doesn't happen again, things like that. Because as much information as I can give out to the world, the better. Because I'm not doing myself any good by holding it in. So that's another big reason why I got into, the Motion Mama and trying to advocate on Instagram, and I'm on TikTok now.
Oh, nice.
But I don't know what I'm doing. I'm just trying to, like I said, give the information that I was fortunate to learn at school and be able to carry out every day. And it's I'm really seeing true changes in individuals' lives. And if I can help one more person out there, then I will do it. So I'm trying to get into the social media world to see if I can help
Yeah.
there. Yeah.
Well, I do love your posts. That
Oh, thank
they
you.
are very informative.
Thank you. I'm still
Can
learning
you
what I'm
just
doing. I don't know.
I'll talk to you about that after.
Okay.
Can you discuss the role of interdisciplinary
Mm,
collaboration in the
mm.
rehabilitation process?
Yes, that is huge. So, that's another big reason actually why I love inpatient so much, is because you don't feel like you're your own island. You are constantly talking and working with the occupational therapists, speech therapists, even the nurses, because again, they're the ones there from whatever 7 to 3, 3 to 11. They're the ones seeing that person for 8+ hours. I get my awesome window for an hour and a half or two, but they're the ones seeing morning, afternoon, night. And I ask them whenever I go into a patient's room, like, well, I mean, I always chart review anyway, but if there's anything
Right.
that was different, was there some change that happened that I didn't see? And we discuss with our doctor all the time too, but with OT, how they do getting dressed this morning? How did they do, making a meal or whatever it might be, getting, in the shower? Do they need help with that transfer or speech therapy? How are they doing cognitively? Is there any strategies that you're doing that I can incorporate in my training so that it's carried throughout all of their therapy interventions? So it's a huge team process, and I really think that benefits the patients.
Do you think more stroke patients should look for a team approach instead of that island of a physical therapy office?
Yes, I do, because again, I learn from my other colleagues even more about my patient, because again, I'm with them for that hour or so, but the OT might have seen something completely different, and the speech therapist might have seen something completely different. And if we can all come together and say, hey, this has worked really well, or this has not worked well, or whatever it might be, then I think that truly benefits the patient the most, because we're all, on the same page.
This is a big one. How do
Uh-oh.
you address the psychological and emotional challenges that patients face during early and later rehab?
That is always a huge one, and another very individualized approach, because again, everybody's going to take it differently. I've had patients who are like, screw this, I'm going to power through and get through it. And I've had others that are like, this has ruined my life. I can't do anything else again. So, like I said earlier, you don't know what you're going to walk into and how they're going to feel about this. So, put your clipboard away, put your laptop away, and just sit, listen to them, let them talk to you, let them feel heard. Because again, you're not going through it, they are. So let them just talk. And I always offer, because again, everybody receives differently. So I'll ask them. I mean, I can provide resources. I can chat with you. I can do, whatever you need. We can go to a quiet space. We can go outside. We can, whatever works for you. So I really try to, again, individualize it, because everybody's going to be different. So
Yeah. Does your facility work with a mental health advocate?
sometimes, not a specific agency or person, but yeah, and sometimes we'll have outside, therapists come in if the person is already, associated with somebody. But
Okay. Yeah,
yeah,
because the depression of not being able to do that and all of that wears on you. I mean, I've said on many of my shows, I sat in front of a bottle of Jack Daniels with my pain pills twice, you
yeah,
know, and
yeah.
7.5 years later, here I am walking
I
and
know. Look at
everything.
you. And it's
So
easier to say now, like, oh, I made it here. But back then, I can't imagine what you were going through.
yeah, it's like I think back and do I rip? Is that what the way it really was?
Right.
You know?
Right. And
Yeah.
I'm sure it was at that moment. Yeah. And
Yeah. I
yeah,
mean, neuroplasticity is just blowing people away now.
it's
I've seen
incredible.
so many people learn things 10 years after,
It's
it,
incredible.
yeah, it really is. I, I, the, um, have you been involved in any common challenges you encounter in your practice and how do you address them?
Um,
Or
I think
what's the biggest challenges you face with patients?
so. I think I guess one of the more consistent things is obviously balancing how much you can push them. I think that's a tough thing to find, because we're in a zone where we wanna push hard, we want to get them where they want to be, but you also don't want them out of commission. You don't want them getting discouraged, right? You don't want them to not be able to participate the next day, whatever it might be. So I think a challenge is taking a step and seeing and understanding, okay, they had this huge change. Their brain is going through so much, not just physically, but mentally and emotionally. And this is a huge, huge recovery. So be patient and, push when they're ready to push and try to take them that next step. But if they don't take 10 steps, that's okay. If they take one, that's a win. So finding that balance for them.
One of the things we talk about in my stroke community circle up here is you have a choice. You can be a stroke survivor or a stroke warrior.
Yep.
How do you get your patients to be in a stroke warrior?
So saying I like to educate, obviously, like we
Yeah,
said at the beginning, telling them this is
very
not,
much so.
yeah, this is not just a couple of months worth. Like this is going to be a lifelong process, a lifelong improvement. So any like learn to celebrate the small wins is something I like to tell them, because you're not going to go from where you are right now to running a marathon tomorrow. I can't even run a marathon now, but you know what I mean.
Yeah,
It's going to take small incremental wins, but when, just like you said, when you look back 7 years ago, you're going to be like, was I really there? Is that where I was back then? So take it day by day and be patient with yourself, because this is not going to be a linear path. Some days are going to feel better, some days are going to be worse. So I just try to tell people to be patient and that they are stronger than they think. And I think
exactly.
you are perfect proof of that.
Yeah, I know many people that are proof of that. I mean,
Yes, me too.
it's amazing that they discouraged us in the medical profession or the therapies or whatever. And it
Hmm.
again, back to what we talked about before, the laziness or they're there just for the job and not work.
Yes.
And
Yeah.
until I found people that were there because of the work, then I started the recovery. It took six and
Right.
a half years to find them, but then it started to
Unfortunately.
happen.
Yeah, but you can see that difference in the person just by talking with them and seeing what they do with you. You can tell if they're really there for you or not.
Yeah, we're starting a new show, or I'm starting a new show Monday morning, um, in our new season called Catch the Wave. WAVE is an
Okay.
acronym for Warriors Achieving Victories Every Day.
I love that.
A lot of I have several of my friends that their first victory is they're putting their foot on the ground at getting out of the bed because
Yep.
so many of us are lost.
Yeah.
You know, we're
Yeah.
lost to death. I mean, it can happen. So,
Exactly. And that's why I say to celebrate the small wins, because just getting your leg off the bed by yourself is huge, because that's, it's something you weren't doing right before. So, and I think people get caught up, and again, they're like, yeah, I did that. Cool, but I'm not walking yet. And that's okay. That'll come in time, but you know, be be celebratory in what you can accomplish.
even the little things, yeah. It's
Exactly.
do you so would you share a particularly rewarding, see, I still have speech issues, a particularly rewarding experience or success or story with a stroke survivor or a TBI survivor?
Absolutely. Actually, I think about this one all the time, because he's another one where his wife sends me videos all the time. He was my first stroke patient ever, and he was 52 at the time. Um, he had a left MCA stroke, so his right side was affected, and he came to us with um I would say mild cognitive deficits, but a lot of flaccidity. He had visual problems. He had a rough go at first, and I had him for uh my first, I want to say 5 weeks, almost 6 weeks. We had him for a long time. His insurance kept trying to cut him, and I was on the phone all the time. I was like, you are not taking this guy away. So I had him for almost a month and a half, and he barely walking. We did the light gait machine, so that big harness. He was on a treadmill. I have videos of me like pulling his foot forward every single step. And then I have videos from his last day where he's walking out with a cane and he's spinning it in a circle. And it's just, I get goosebumps just thinking about it. It is my favorite thing in the world. And a couple of years later, his wife had sent me a video. He retired. And so he was like running out of the building that he worked in, and he wanted me to see that video. So I just that, and obviously, unfortunately, that's not always, you know, the outcome for everybody, but that just that sold me. I was like, this is the population, and I'm here for it.
Yeah. Are there any upcoming projects or areas of study you're excited to explore?
So through, you know, my work, we do they'll offer like continuing education courses and things like that. And I'm trying to see, sorry, my cat.
That's all right.
I'm trying to see if I can sign up for the NDT, that
Yeah,
neurodevelopmental.
yeah.
Yeah, so that's
What
a
does
big
that
one.
stand for?
Neurodevelopmental technique. So it's,
Okay, thank you.
yeah, of course, very focused on again connecting the brain to the body and learning different tactile cues and things like that to help with neuro rehab. So that's something that I would love to obtain, because any other improvement or knowledge that I can gain to have more in my toolbox, the better.
Yeah. How do you envision, well, tell us a little bit about Motion Mama.
Yeah. So I started that on my maternity leave last year. Again, just combining physical therapy and motherhood. I at first was posting just like some goofy videos of being a mom because I wasn't at work at the time. And then when I went back to work, I was like, you know what? I'm gaining a little bit of a following. Nothing crazy, but just enough where I'm like, you know what? Maybe some people out there are interested in this kind of stuff. And I just started on TikTok too. So that seems to be growing, I would say, fairly decently. And it's just another way for me to, like I said, share some of my knowledge. And it's only been 5 years, but I can't even believe all that I've learned in 5 years. So I just being able to share what I've, gotten so far. And again, if it helps just one more person, or I have a lot of student physical therapists that follow me. So if I can help them in their careers and impact more lives, then I'll feel like I'm doing what I was here to do.
Your sheer uh, intuition about people in just 5 years. I mean, about asking, what do you want? What do you do? That's
Hmm.
amazing. And
Thank you.
I hope more physical therapists listen. What
I
do you
hope so.
have? Yeah, what plans do you have for the future of Motion Mama?
Um, I think still I would like to kind of incorporate that interdisciplinary approach and maybe have some occupational therapists and speech therapists kind of come on just like you do and try to, get everybody's perspective on things and kind of grow my page that way. So again, people going into the field or individuals maybe like yourself or somebody who are always looking to learn more and see what else people are doing out there. If I can provide as much information as I can. So,
And we started this to tell people we didn't know what we didn't know,
mhm,
in the beginning. Um,
mhm,
and that was so frustrating for all of us. What do you
mhm.
wish survivors and their families would have known early on that in most cases don't know?
Um, I would say that I think I might have said it already, so I apologize, but that
No,
recovery
it's
is not linear. So again, take it day by day, because I think people think, okay, this is this is where I am. I'm not going to get better from here. Like this is it. And that is just not the case. It takes time. Some days are going to be better than others, but just wait till that one day where you do stand up with less help, or you do take your first step, or you do roll in bed by yourself. I know it sounds little and small, but it is huge. And so, again, it's not linear. Be patient, and you'll, stay consistent, because again, it's a lifelong, thing that you're not stuck. There's ways out of this, and just believe in yourself.
I'll jump to the therapist. You just gave something for the survivors. Now let's jump to a therapist. What
Mhm.
advice would you give to aspiring physical therapists who are interested in specializing in neuro rehab?
Do it. It's amazing. But I would
Perfect.
say, but it is, I personally, just having experience in other settings too, I think it's the most complex. So, um, be patient with not only your patients, but yourself too, because you're going to learn all day, every day. And again, you have to be flexible. You don't know what you're walking into when you walk into a room. So be creative, be flexible, and just think outside the box and enjoy it. I mean, we don't, there's not a lot of professions out there that you can make an impact on people's lives in this way. And I think it's a privilege to be in this field. So enjoy it.
How do you envision the future of rehabilitation for stroke and TBI patients over the next decade?
That's a good question. I'm hoping, well, I think we'll see a lot of more technology driven interventions, especially like I said earlier, with the way AI is coming around and emerging. I think there's going to be a lot more technological advances, maybe even in biofeedback, things like that. And I hope there's more and of an expanded opportunity, especially in like outpatient neuro rehab. Because I want my patients, once they're done with me, I want them to be able to continue what they've done and not just go to somewhere and sit on a bike, like you said, for 10 minutes and go home. I want, specific services that are, like I said, like almost like an inpatient, but in an outpatient world, so that people can really maximize their long-term recovery.
Love it. To
Thank
wrap it up, anything
you.
you'd like to add to our discussion today?
I'm just very thankful that you had me on here. I think your mission with your radio is incredible, and I'm happy to see that there's a community out there that, you're benefiting a lot of people by doing this. And I appreciate you having me on. And again, to everyone out there, whether you're going through this or whether you're a therapist helping people through this, like, you're making a difference. And again, it's day by day, and it's gonna be it's gonna be an incredible journey. So,
I often say this has been the most difficult thing I've ever had to do in my
mhm.
life, but it's become the most rewarding.
Isn't that amazing? Yeah.
Yeah, it
Mhm.
really is. So how do
Mhm.
we find out about Motion Mama?
So yeah, my handle is at the Motion Mama on Instagram, TikTok. I'm on YouTube now, trying to get fancy. So, so please feel free to follow me. I think on most of those I have my email as well. So I am always willing if anybody wants to email me personally. Again, whether you're a patient or a therapist or whatever, because again, if I can spread my knowledge and help anybody else, I would love to do that. So please feel free to reach out.
Wonderful. That's great. Thank you very much for that.
Thank you.
I have totally enjoyed this today. You've been one of the best interviews I've done for a therapist.
Oh,
Thank you very much.
thank you so much, Ralph. I really appreciate it.
Oh, no problem. You take care.
You as well. Thank you so much.